So in Module 4, we're going to delve a little bit more into the diagnosis of neurocognitive disorders, both major and mild, and learn a little bit about the history of the disorder and when it was first discovered and how it's kind of progressed from here. So what we're first going to do is look at two of the pioneers of neurocognitive disorders. And unlike a lot of the other psychiatric disorders that we've been talking about, neurocognitive disorders are really closely linked to specific types of neuropathology. And so it is probably the most connected to brain science as any of the disorders. Now, that's not to say there aren't changes in the brain in all the other disorders we've talked about throughout this semester, but those are not as tied as closely as we see with the neurocognitive disorders. And so two of the pioneers in regards to the research here who were the first to notice these kind of brain abnormalities among individuals who'd had really impaired cognitive functioning were Alois Alzheimer and Emil Kraepelin. And so you can see Alzheimer there in the upper left-hand corner, and you can see Kraepelin down in the lower left-hand corner. And both of them were heavily involved in the research. And of course, Alzheimer ultimately had the name of one of those neurocognitive disorders named after him. Now we're going to look at specifically both major and mild neurocognitive disorders and some of the characteristics. These are going to be based on the DSM-5 symptomology. And so you can see with a major neurocognitive disorder, this is going to include dementia and other related forms of significant cognitive decline. In this case, for the DSM-5 to qualify, a person has to exhibit evidence of significant, and significant is the key here, cognitive declines in one or more domains, and that could be cognitive domains, social domains, and thereon. Those cognitive deficits have to interfere with their independence in everyday activities. So that's very similar to some of those other symptoms of social and occupational impairment that we see with a lot of the other disorders. So once again, these not only have to create some issues with the individual, but also in their everyday activities. And then that cognitive problems must be above and beyond anything that could be attributed solely to delirium or another mental disorder. So we do have memory impairments in certain disorders, including depression. So if somebody is depressed, you may use that as a rule out for major neurocognitive disorder, though you can have both of them occurring at the same time. And then we talked about how delirium is much more of a momentary, and so you don't see the duration or the slow, steady decline that you're more likely to see with the major neurocognitive disorder. Now, if you look, there's a little bit more detail here in regards to the DSM-5 criteria, but it's pretty much what I just went over. I just wanted you to have a sense of these type of disorders and which ones would specifically qualify under. So in other words, when we get into our next module in Module 5, we're going to be starting to go through some of the types of neurocognitive disorders. You can see them down there at the bottom of the criteria, including Alzheimer's disease and frontotemporal lobe degeneration. So if you're not a major neurocognitive disorder, you may have mild neurocognitive disorder by the name implication. Going from major to mild, mild is going to be a less severe form of neurocognitive disorder. Same types of criteria, but there are two little bit of differences here. And what we see with that is the evidence is going from modest from what had been significant. So remember, I pointed that out in the criteria that it needed to be on the modest side instead of significant, and that the cognitive symptoms should not be interfering with the person's capacity for independent activities in every day. And so you're not seeing, they're still going to be able to function independently. Yes, they are showing signs beyond just what would be predicted in their declines of fluid intelligence, but you're still going to be able to function. with a little bit of help. And that's when you're going to see the mild neurocognitive deficit there. And then here is the DSM-5 criteria. As you might notice, once again, you can diagnose it and then specify the specific subtype of the mild neurocognitive disorder that is in evidence. So as I just alluded to, in Module 5, what we're going to be discussing is specific types of neurocognitive disorder and getting into more details then. Thanks.